My name is Jessica Rapp, and I am the Public Information Officer for Carson City Health and Human Services. We're here today to discuss the first presumptive positive case here in Carson City. I'm now going to turn it over to our mayor.
Good afternoon, everyone. We called this press conference to let our community know that a resident of Carson City has tested positively for the COVID-19 virus. I want our community to know that we are fully prepared for this eventuality and are following all federal and state protocols related to the safety of not only the infected person, but the safety of the residents of our city as well. We are working closely with the governor's office and our state health partners. While this is not necessarily a cause for alarm, it is cause to redouble our individual efforts to ward off the spread of this virus. At this time, I would like to introduce Nikki Aker, who is the director of our Health and Human Services Department, who will go into more detail regarding this particular event. Nikki?
Thank you, everybody, for coming. As you've heard, today, Carson City Health and Human Services received a presumptive positive case of COVID-19. This is the first case in Carson City Health and Human Services surveillance area, which includes Carson City, Douglas, Lyon, and Storey counties. The test has been sent to the Centers for Disease and Control Prevention, or CDC, for confirmation, and this is the protocol that follows with each positive presumptive case. The case is a female in her 70s. The individual is currently isolated at home. She has a husband, and he is isolated and being monitored. This case is a travel-related case. The individual previously traveled from San Jose to Reno. She called her healthcare provider. Today, she reported that she is feeling better. At this time, there are still no other cases in the other counties managed by Carson City Health and Human Services. The risk to our community is considerably low. What we are doing is contact tracing of individuals that our cases come in contact with, and we are monitoring her husband. As a reminder, Carson City Health and Human Services has set up a hotline for individuals to call concerning COVID-19, and that hotline number is 775-283-4789. Again, that number is 775-283-4789. That line is currently open Monday through Friday, 8 a.m. to 5 p.m. And at this time, I would like to introduce Sean Sleeman, who is our fire chief for Carson City.
Good afternoon. Carson City Emergency Management continues to work with our partner agencies within our quad counties that include Lyon County, Storey County, and Douglas County. As a group, we are continually monitoring the COVID-19 outbreak. We are continuing to keep our leadership within our city and our adjacent counties informed of the latest information as we become aware of it. As a city, Carson City has a plan in place already for serious infectious viruses and diseases such as this. It has not been enacted yet, and it will be as deemed appropriate as more cases evolve. To the public, preparedness should not be just now, but always. We should live in an area where we are continually impacted by serious weather, by fire, and potential earthquakes. We should all be prepared. If you go to Carson City Fire Department's website and you click on the emergency management page, you will see basic recommendations that you as a citizen can be prepared for for an event such as this. If someone in your family does get sick, you need to prepare your entire family for the long emotional and physical strain that it could impact on them. We encourage healthy preventative measures all year, regardless of this virus, that include hand washing, covering your mouth for sneezes and coughs, and wiping down commonly touched surfaces. Thank you.
At this time, we will turn it over to questions. We ask that we limit the question session to 10 minutes. Media that are present in the room, you need to raise your hand and we need to bring a microphone to you before you ask your question.
So with your limited explanation of the first patient, it sounds as if she did everything right, correct? You know, and you know what I mean, but calling first, not showing up, doing all those things. So can you talk a little bit about that?
Yes, she did do everything right. She called her healthcare provider. She has self-isolated. She has been very diligent in doing her preventive measures. So yes, she has done everything right.
We've heard that some private labs are going to be getting involved in increasing the testing capacity here in Nevada. Has that happened yet?
So yes, some private labs are getting ready to get up and running to do commercial. It's a commercial lab. And as of right now, they have not been able to do testing, but that will be in the future.
Where was she tested?
So we had arranged for testing for her, and we put staff in place to test her. It's not the hospital, not a healthcare provider, and I'd rather not disclose the location so that we can continue testing without individuals bothering the people being tested.
Where was the test obtained?
The test was obtained in Carson City.
No, I mean, where did Carson City get the test?
So we got the supplies through an agreement with the hospital.
Okay. And one other question, where are you with this tracking of the individual's acquaintances or whatever, however you phrase it?
We just learned of this case today, so we are not very far in our contact investigation because we've been so busy trying to put this press conference together and that's why we're only limiting questions to 10 minutes so that we can get back to work.
I'm sorry, we're a little late. How did she get the virus? Can you explain that again, once again? I'm sorry about that. Oh, can we move that microphone up a little, over a little?
So the case is a female in her 70s, and she has a travel-related history. So the individual previously traveled from San Jose to Reno.
Do we know how she traveled, plane, car? Can you disclose that information?
At this time, I'm going to invite Dustin Booth, who is the epidemiologist for Carson City Health and Human Services, up to the table to address this question.
Sit down here, Dustin. Sit down.
Thank you, Mayor. So the individual traveled via plane while she was asymptomatic.
Is she part of that group? Was she part of a cruise or is she part of that group? I mean, we want to make sure we're doing all that. Is she part of the cruise and all
She
that
is
stuff?
not part of the passengers that were on Princess Grand.
Is Carson City planning to close any schools or impose any restrictions on large events as a result of this?
This is only one case, and it is travel related. It's not a spread within our community. Of course, no, at this time, we're not planning on advising that, but we will continue to monitor the situation because the situation, it changes on a momentary basis.
Speaking of the cruise ship passengers, there are some Carson City residents that were part of that cruise. We learned a couple days ago that they were going to be tried to be repatriated into Carson City. Have they been, and is that plan still the plan?
So at this point in time, this press conference was to address the first presumptive positive case here in Carson City. We're working with the governor's office on the repatriation of our residents. So if there's any further questions about the presumptive positive case here in Carson.
Were there any other family members when she traveled? Are there any other suspected patients as well that you know of that you're testing?
Thank you for that question. So this press conference is being recorded and will be posted to our YouTube channel after the conclusion of it. You can find out that information from the recorded press conference. Are there any other questions? We only have a few more minutes left.
So am I to understand then that you got the test from the hospital and she was tested at home? Is that what you're saying?
No, that's not what I'm saying.
So you can't say where she was tested?
It was a testing that Carson City Health and Human Services arranged.
Okay. And going forward, how would an individual who was not feeling well get tested?
So first, they need to go to their healthcare provider again, and then we do have the hotline that I gave out, and they can definitely call that hotline and ask questions through that manner, and those questions do come to us if it's questions that cannot be answered by the individuals that are answering the calls.
What happens next? As in relationship to this patient, what's the next step? I know the test has to go to CDC for confirmation, but what happens next?
So what happens next is the contact investigation. So we will look at who she has contact with, and we will follow up with those individuals. That's a normal disease investigation process. We'll be monitoring her husband, and that's what happens next. And like I said, she reported that she's feeling better today.
Are you able to disclose what airline and if other passengers on that flight are being tested?
So we just learned about this case today and are doing this press conference, so we're still in an active case investigation.
Just to clarify, you say that she is from Carson City, not any of the other counties in your jurisdiction.
Correct. She is from Carson City.
How long ago did she return? Do you know? From San Diego?
Let me make a correction. It's not San Diego, it's San Jose.
That was my mistake, not yours.
She returned from San Jose on March 2nd.
Do you guys have any procedures in place to help people that are in isolation? In this case, you're talking about both her and her husband in isolation. Is there a procedure to get them food, medicine, and other supplies they need?
So we do have a protocol that we're following, and we'll be contacting the individuals. Of course, we're in close contact with them now, but if there are needs that they have, then we will address those.
At this time, we have time for one more question.
I'm just wondering how, is there any kind of a major or minor outbreak in the Santa Clara area around San Jose, and that, is there a lot of people there, or are they just finding out what they've got?
At this time, I don't know. I just know that our case obviously had traveled to that area, and I think the Washoe County case, one of their cases had traveled to that area. I do not know about a community outbreak in that community.
Okay, that's the conclusion of our question session. Thank you guys for coming today. There will be more information released as it becomes available. You can visit our website, gethealthycarsoncity.org, to find new information. Thank you.